Good evening, everyone, and thank you for joining this dental learning webinar, sponsored by Schein TechCentral. I'm Joe Riley, the Director of Content for Dental Learning. Our distinguished presenters, Jim Crook, Dr. Mark Wilk, and Jeff Drost, are with us tonight to discuss the importance of protecting your patient data. Data theft or disaster can happen at any time, resulting in patient data loss, devastating your practice. Tonight, our presenters will discuss how to avoid losing your patient records, financial data, payroll, and other critical practice information. They will help you understand the threat to your patient data and share helpful tips and steps your practice can take to prevent a cyber breach, be prepared for an attack or disaster, and learn how to cut down on the discovery and recovery time with a redundant, remotely managed backup and recovery solution. Jim Crook is Director of Marketing at CTERA, where he is focused on sales enablement, product marketing, and customer and partner success. Jim has spent the last 10 years in a variety of marketing roles across enterprise data storage and security, and prior to CTERA, worked in corporate marketing for Carbonite, a data backup provider. Dr. Mark Wilk graduated from Columbia University School of Dental and Oral Surgery in 1987 and completed his general practice residency in dentistry at St. Luke's Roosevelt Hospital Center in New York the following year. He then joined Tudor City Dental, where he currently practices and serves as the office point person on practice management systems. For the past 2 years, Jeff Drost has been helping Schein reps better identify and provide dental offices with the right IT solutions to help them be more productive and protected. His over 20 years of experience across an array of industries has helped him become a successful, proven results leader with the ability to create new and unique business opportunities and marketing ideas. Thank you again for joining us this evening, and now I turn it over to Jim Crook.
Thank you for the introduction. Hello, everybody who has joined the webinar today. My name is Jim Crook. I am Director of Marketing at CTERA. We are a provider of secure enterprise file services, and specifically pursuant to this webinar today, we're going to talk about our hybrid backup appliance, our cloud storage gateway. So look forward to talking about that with you. Just a little bit about me. I've spent the last 10 years in a variety of marketing roles across the storage and security industries. I was with Carbonite prior to CTERA, so secure and efficient backup and prevention of data loss is something that I've been focused on for quite some time. So we'll get into it right now. And so we're thinking about, of course, in this webinar, the importance of hybrid backup. And we begin the conversation really with how the dental industry today thinks about data loss and the types of data loss events that can happen to a dental office. And of course, you have natural disasters such as fire. There's a fire in your office, you lose your data, you lose your servers, everything goes down. That, of course, would be a terrible event. Of course, along the lines of other natural disasters, you have flooding. We've seen that happen around the world, around the U.S. in the past few years, flooding damage from hurricanes or any sort of natural weather event like that. As well, there's always the idea that you could be robbed, even by a UFO in this case, right? But the idea that someone could break into your office, steal your data, and you can have a data loss event in that way. So those are three, main areas that a lot of people think about when they're thinking about how they might lose data. But all of these combined are statistically insignificant to the number one threat to a dental practice's business continuity. And maybe some of you in the audience today can figure out what that is based on this picture clue. But look in the background there, where there's a keyboard, there's a computer, there's a mouse, and there's a user there who can potentially be making unwittingly some very serious human errors that can cause a lot of problems for an organization in terms of data loss. And that's really where we're gonna focus much of our talk today, around this idea of human error. And we know statistically that 75% of all data loss across all organizations, not just limited to dental offices, but definitely applies to dental offices, 75% of all data loss is due to human error. And it's really based on these two keys that you see on your screen here, the delete key and the enter key. pressing either of those buttons can unleash significant problems for a dental office, and we'll talk about why that is. Most particularly, you probably have heard of this of the ransomware epidemic that's been going around, and human error is a leading cause of having your files within your organization encrypted. So you might get a screen like this if one of your users unwittingly hits one of those keys or makes a wrong mouse click and brings in a ransomware or a malware, any type of malware into your organization. And just so everybody's clear about what happens with a ransomware attack, we've put this brief diagram into the presentation just so you have an understanding of what might happen. And this varies from ransomware strain to ransomware strain, but largely it follows something like this, where on the left-hand side, you'll have a piece of malware that's introduced into your network via a web page, a compromised web page, or a spam email. And again, your users are the ones who are the gatekeepers in your organization, and they might be stumbling into emails and websites that they shouldn't be opening or going to. But what will happen is once they do that, once they allow that piece of malware into the organization, into their desktop, the desktop gets infected, and locally, all those files and those hard disks on that machine are encrypted. If that's not bad enough, ransomware is built to spread. So it's going to spread to the shared PCs on your network, the file shares, the shared applications that are all on your network, locking all of those up as well. And then lastly, as if it's not enough that the criminals lock up your files and hold the key, the files themselves are also often copied to the criminal network. So they hold the key and they hold a copy of your files. So they really the deck is stacked against you in that regard, and the criminals hold all the cards. So just to give you an example of what might happen, and we talked about a spam email. This is how an attacker might go after your dental office today. This is an email that on first blush might look fairly official and look legit. But if you look a little closer, you see that Barrett Gallagher's email address is a little fishy. It's got a .in and a weird domain name. It doesn't really align with Community Health Systems or who he says he is representing. He's also attaching an invoice. And this is really what the attacker wants you to click on and wants your users to click on. Because if you do that, and you open the document and you see some sort of gibberish like this, it's going to have instructions as well that if you want to fix this data encoding, you need to enable a macro. And once you hit that option button and enable that macro, then the ransomware is executed. It's downloaded into your system, and you get a note, something like this. And this is an actual copy of a ransomware note from a strain of ransomware called Cerber, which is a very widespread and well-known piece of ransomware. And at that point, you're really at the whim of these attackers, unless you have some sort of rollback data protection plan in place that you can get back to a previous uninfected state. And we're going to talk a little bit about that and how you can do that with CTERA and Henry Schein. I did a quick search in terms of dentists who had been impacted by ransomware in recent times. I did find a dentist from Alpharetta, Georgia, who pretty much outlined exactly what we just talked about. Someone in the office opened an email they thought was legit. The virus immediately took hold. He said, "We knew something happened almost in seconds." Morton said, the computer that the virus attacked just immediately started to slow down. So this is an example of somebody who was able to actually roll back from a ransomware attack. If you watch this clip online, you can see that he's able to roll back to a non-infected state. But all too often, this is he's in the rare case. More often than not, organizations are not prepared. Dentists are not prepared to protect themselves against this kind of attack. And more often you see something like this, which is the Hollywood Presbyterian Medical Center. This is in California. A couple of years ago, suffered a major ransomware attack where all of their data, all of their patient data, was held hostage for about 10 days. They had to turn patients away. They had to start using pencil and paper and faxing because all their network information was locked up. And they wound up paying, rumored, about $17,000 in Bitcoins. And this is one example that you'll find online, but there are many more examples, and most of them do not admit to having some sort of attack like this for a variety of reasons. They don't want their patients to know that their data might have been exposed. They do not want to be associated with lax lax IT processes and preparation for these data loss events. So we know ransomware and malware is a huge problem, but the actual examples that are linked to it are hard to find for those reasons that most of these victims don't want to be in the news about it. But we do have some pretty gruesome, perhaps, ransomware numbers here to report to you. You see that in 2016 on the graph, this chart from Symantec, 2016 there was a spike in ransomware dollars spent per ransom attack, and that was really driven by two things. In 2016, the ability to send ransomware and create ransomware was very simple. The tools to do these sort of criminal activities are widely available on the internet. You can find them wherever you are. And then secondly, perhaps more importantly, was the rise of Bitcoin around this time. So Bitcoin allows you to send and receive anonymous payment, encrypted payment, so you don't know where you're sending this. So as a ransomware attacker, if I can lock your machine and make you pay me in Bitcoin, you'll have no idea who attacked you, and I get away scot-free, essentially. So that really drove, in 2016, this rise of ransomware. The latest statistics we have are around $500 per ransomware infection from Symantec. And bear in mind that this only relates to a single infection. So if you have multiple machines, you have multiple infections in your office, you can be looking at a far higher figure that you'll be on the hook for if you don't have a data protection plan in place. We also know from Symantec that 64% of ransomware victims in the U.S. have paid the ransom, and that willingness to pay and the rising adoption of cryptocurrency, as we talked about, have really factored into the growth and persistence of ransomware. A couple more numbers for you, just so you understand the severity of this problem. A company is hit with ransomware every 40 seconds. 72% of infected businesses lost access to their data for 2 days or more. So you can think about what that would do to your business. 1 in 5 businesses that paid the ransomware never got their files back. So think about that. Even if you pay your ransomware attacker, what they demand, there's always the chance that they might not give up the files at all. It's really up to the ransomware attacker and if they want to help you out or not. And then this is another large stat that 5 billion, the global ransomware damages were predicted to exceed 5 billion in 2017, and those are the latest numbers that are available today. I'm sure we'll start to see 2017 final figures or estimates as we get later into 2018. But just a massive problem at a global scale. So all industries, or seemingly many industries, have outlined steps in which organizations can move to protect themselves from this sort of attack. And so the Health and Human Services Office of Civil Rights in July of 2016 put out a fact sheet on ransomware and protecting patient data and ensuring compliance with HIPAA and other regulations. And they asked, how can you recover from these infections, these ransomware infections? And I've highlighted below the key points from that answer. And what they say is maintaining frequent backups and ensuring the ability to recover data from those backups is crucial to recovering from a ransomware attack, and that dental offices should consider or not just dental offices, but in this case, we're talking largely to the dental community, your offices should consider maintaining backups offline and unavailable from their network. So have the ability to recover from a ransomware attack by utilizing an offsite resource and not just having an on-site backup appliance that might get locked up in a ransomware as well, in a ransomware attack as well. And so that's where we come in. CTERA and TechCentral today offer a all-in-one solution for your office file services and data protection needs. It's what we call a cloud storage gateway. And this is an all-in-one backup appliance and file server. So it replaces these sort of legacy appliances that you might have in your offices, including storage servers, Windows file servers, backup appliances, and replaces them with an all-in-one cloud storage gateway that solves all these enterprise file services and data protection needs. So your users can have up to 4 terabytes of usable capacity. Internal disks are mirrored for high availability. The gateway today supports up to 50 users per office and has WAN optimized backup to an offsite data center. So you're sending very secure, very efficient chunks over the WAN to your offsite data center, which is powered by TechCentral, I should mention. Okay, so I'd like to take you through now a quick diagram on how the cloud storage gateway works in concert with the TechCentral cloud. So in this diagram, you see that the cloud storage gateway in the center of the diagram can transmit data to the TechCentral cloud. But we'll start over on the left-hand side because the cloud storage gateway also acts as a local file server, as we mentioned. So your users have access to their My Documents folders. They have access to group project folders. All the machines and all the devices that you have in your office can connect to the cloud storage gateway, which acts as a central file server for your entire office. The gateway supports typical NAS protocols such as NFS, SMB, iSCSI, and down the line. So it's essentially the same sort of local user experience that your users have always had in accessing files from their file servers. In addition, the gateway comes also pre-bundled with backup agents, CTERA Workstation and Server Data Protection agents. And these are lightweight software agents that run on your users' machines in the office as well as your servers. And you can use those to back up data to the cloud storage gateway which acts as a local and hybrid backup appliance. So you have a copy of your files on your gateway, a backup copy of those files, and you also transmit that to the TechCentral cloud, acting in a hybrid backup manner, and we'll talk a little bit about that now. So, but before the data leaves the gateway and moves to the TechCentral cloud, it's deduplicated, it's compressed, and it's encrypted with AES 256-bit encryption. So you're only sending the smallest or the most efficient chunks of your data over the wire, and it's compressed and it's encrypted before it leaves as well, which means it's highly secure and helping you to comply with industry regulations such as HIPAA and anything else that your office must adhere to. As well, when it's encrypted using AES 256-bit encryption at the source, but it also is sent over the wire using TLS 1.2, which is a highly secure and encrypted transport protocol before it gets to the TechCentral cloud. So it's encrypted at rest and it's encrypted in transit as well. So as well, you have the ability to, as an administrator, the top right over here, incremental gateway snapshots are shipped to the cloud, which means as an administrator, you have the ability to set your snapshots to as often or as infrequently as you would like. And then your data retention policies are configurable to optimize gateway capacity and recovery time. So I can say that I want to maintain a certain amount of files on my gateway. I can move the rest to the TechCentral cloud, or I can keep a one-to-one replication of all the files on my gateway and replicate them to the TechCentral cloud as well. And so that's the beauty of a hybrid backup appliance. If any of your machines goes down, you can use the gateway locally to recover, which is a very quick way of recovering your files. So you have all your files on the LAN, accessible through the LAN. But if for whatever reason your gateway is impacted by a data loss event, such as we mentioned, a ransomware attack or any sort of natural disaster, you always have the ability and the safeguard to download your files directly from the TechCentral cloud. So it's a way to ensure double protection against any sort of man-made or natural disaster. So just to sum up there, we talked a lot, but just to sum up, the gateway acts as a file server on the left, a NAS replacement. It acts as a local backup appliance. And then it also acts as a hybrid backup appliance and moving that data off the local machine and into the TechCentral cloud with the highest levels of security and data encryption. And so another key aspect of the gateway is that we offer limitless file versioning. And this means that you can roll back to any point in time, and this is a screenshot of what you'd see as an administrator. You can roll back to any version of any file or any folder since it's come into existence and download those files back to your gateway in the event of an attack. So let's say you created a file on May 22nd and it got infected or your machine got infected on May 25th. You can roll back to the snapshots that took place between any point between the creation of the file and when it got infected. And this is an important aspect of your recovery. You want to roll back to a non-infected state, a non-ransomware infected state, and you can do this using your file versioning. And we say limitless file versioning, which means you can back up your files every hour if you'd like to, or you could back up your files every 24 hours, every week, every couple of days. We'd probably recommend at minimum every 24 hours. It's really up to you in terms of how many versions that you'd like, both on the local gateway and both in the cloud. You have total control over how many versions that you want to have access to. So as mentioned, this is a very secure platform that we offer together with TechCentral. It comes with highest levels of encryption. We use the AES Advanced Encryption Standard for 256-bit, which is a very powerful encryption standard on the gateway. We have authentication support, especially in the way of useful passphrases for backup. So you can, as an admin, always have the ability to set a passphrase and ensure the confidentiality of your files, that only you have access to them. And all of this encryption, security, privacy matters, they've all been thought of and built into the platform so that we can help you as a dental office comply with the regulations that you need to meet. So this is a hybrid backup appliance that's built to meet your security, your data security, and your data privacy needs. And so that's going to wrap it up for me today. I just wanted to recap quickly that CTERA and TechCentral today offer cloud storage gateways that minimize the threat of any natural or man-made disaster. These are appliances that allow you as a dental organization to easily and seamlessly recover data with cost-effective hybrid backup services. So at this point, I'd like to pass it over to Dr. Mark Wilk of Tudor City Dental, who will take you through his own experiences using the CTERA and TechCentral solution. So take it away, Mark.
Hello, everyone. My name is Mark Wilk. Just a little bit of background about me. I graduated from Columbia University Dental School in 1987. And after that, I joined one of my friends from Columbia who had started a practice in Manhattan. And together we developed this practice over a 30-year period. We now have 8 operatories, rather large practice. We have another partner now and 4 hygienists staying. So we run fairly busy office. And because of that, one of the things that we realized as we were growing was that the only way that we could really grow as much as we wanted to was to embrace technology as much as we could to enable our efficiencies. There's many things that you can't do to cut corners in the operatory, but in order to be efficient, the best way that we found was to harness the power of software and computer technology to make our practice as efficient as possible. In keeping with that technology and software theme for advancing your practice, one of the most important things that you can do, if not the most important, is protect the integrity of your data. Once you're so reliant on it, if you ever lose that data, your practice may never be the same. In order to keep that data, we all try to back up as best as we can. Many of the backup processes that we had were manual in the past. So whether you're using Dentrix or using any other practice management software, you're trying to back up every night. If you're using Dexis, the way that you had to back up was every night a manual process of backing up your Dexis images and data to something called DexSafe. And then DexSafe was then backed up with your practice management software by manually starting your backup process if you use Retrospect or any other backup program. And this was a nightly occurrence, and I think that everybody knows that at night, at the end of a long day after seeing many patients, this is something that you might not do reliably. I know I didn't. I would forget. And when I forgot, I would start my journey home, and many times the weather would be inclement, and I would get 1 block from Grand Central and realize I forgot to start the backup. So back to the office I went in the rain just to click those buttons. It was the bane of my existence sometimes. But it really became a problem for us worrying about these backup entities in 2014. A number of years ago, we had to get a new server to upgrade our server software and operating system. What we did at that point was we took one of our old servers and set that up as our backup drive. So the backup would go from our new server to our old server. Instead of using a standard hard drive that you would attach to the new server, we just had it go over our network to our old server, and we formatted it accordingly. The thought behind this was that if, in case of an emergency, if we had a problem with our server, we could target a few workstations to the old server, continue our work accordingly, wait for our new server to be repaired, and then migrate all of our data that we had accumulated over the past few days from the old server back to the new server and continue in more of a seamless fashion. What we realized was that even though we had been somewhat reliable in trying to get those backups to go through, clicking those buttons every night, what was happening was that our backup was not reliable in and of itself. And we only realized this when we needed it. One night, our RAID 5, which is the assembly of all 5 disks on a server, and they mirror each other. And usually only one will go down. One will have a problem or become compromised. When that becomes compromised, you can take a new disk, insert and replace the compromised disk, and it will write from the other disks in your backup. In this case, which is a rare circumstance, the entire RAID 5 assembly was compromised, and we lost all our data on that server. Fortunately, we thought, well, we had our backup that was being backed up every night, that we were reliable enough to click that backup button on our old server. So the first thing we thought was, let's go to the old server. Let's open everything up. We'll target a few workstations to that old server and be up and running. Unfortunately, that wasn't the case because the backup was compromised. We now had to figure out how to get our data. What was compromised on that backup was some metadata of some BAK files that would tell the images where to go. So essentially, all of our images were there on our backup, but the computer didn't know which image belonged with which patient and what date that image was, because that metadata on each image was no longer there. Fortunately for us, we also had a cloud backup with Dentrix. And thank goodness we did, because Dentrix was able to harvest that metadata, email it to us, we imported it into the server, into the old server, and when we restarted the computer and opened it up, everything was where it needed to be. So we were back up and running. When this happened, I began to realize really how important the backup was and how much we relied on it and how much the backup needs to be reliable and we need to be reliable in backing up. And I kept thinking to myself, there has to be a better way. You're going to rely on me to be reliable, and we need to rely on the integrity of the data to be reliable. And so we're relying on the integrity of the backup itself to be reliable. How can this be transformed into something that's less stressful, more automated, and more reliable? Well, about a year ago, someone from Dentrix called me and said, because they knew that we had previous problems with the backup, we have a new backup solution. It's called TechCentral Hybrid Backup. And they explained to me how it worked. This CTERA hybrid system will not only automatically back up every night without you having to do anything, it will then take that backup and send it to Henry Schein without you having to do anything. So TechCentral will monitor their cloud backup as well as the backup on the CTERA hard drive backup unit that's in your office. And I thought that this was too good to be true. How could it be so completely automated? The CTERA hybrid backup unit is 100% automated in that you do not have to open a program or click a button, but open a program or click a button to initiate a backup. It will initiate on its own every night. And there is a blue light on the front of that CTERA unit. As long as you're sitting in your office and you see that blue light on, you are backed up. But after a while, I thought to myself, a month in, 2 months in, 3 months in, I have not done anything to verify the integrity of that backup. I would call TechCentral and say to them in the beginning, are you sure it's backing up? I haven't heard anything. I don't get email notifications. They said, no, it is backing up. If it doesn't back up or there is a problem, you'll get an email notification. I said, fine. But still, haunting me was what happened to us in the past. And I was wondering if the integrity of the backup that's on the CTERA unit is actually sound. So we had to come up with a verification system. And thinking back as to what happened previously, we thought that the best way to verify was by verifying images. Why not see if we could open up an image in a simple way that doesn't require a lot of time, and we could maybe do this once a month to verify that the backup is going through. And this was the system that we developed to aid in verification of your backup. So where do you start? Well, we start by opening up Dexys on our computer. And on your desktop, there'll be a Dexys icon. And once you open that up, there'll be a print icon at the top of your Dexys. When you click it, you'll see a few choices there, but we go to Export Activity List. We're going to export this to the desktop, and we'll select dates, maybe 2 days before. You can go a week before. You can customize this to however you want, but for our purposes, we would normally just do the day before or 2 days before for verification. Once we export that, you'll see the icon on the desktop next to your Dexys. Now all we need to do is open that, and that'll give you all the activity that you've had, all the images that you've imported into Dexys over that customized period of time. When we open it, we see all the images that are there. Now, the way that Dexys formats its files is with a 6-digit entity that allows you to locate what you need to find. So when we open up the activity log, we can just pick one 6-digit number associated with any one of the images, and just remember that. Oftentimes, I'll just take a quick photo with my iPhone to have it. And now at this point, we have an image that we want to see on the CTERA hybrid backup. So now we have to go to our CTERA unit. On the back of your CTERA unit, you will see a serial number. And the way that you log into the CTERA unit is simply take the last 4 digits of that and then go to your browser and type in the address of the CTERA unit with the last 4 digits, and the CTERA unit will open. Once it's open, log in. You will have credentials. You can change these credentials once they give it to you. Once you are logged in, you will begin to see a file structure and a folder structure that replicates how things looked on your server. One of the nice things about this is that when you look at this, it will be familiar to you. It will be familiar to you from every time that you've gone on your server and had to open up something in Dentrix or in Dexys or in any other practice management system that you have. As you open up the folders, you'll see that the format is similar, and all you need to do now is open up Dexys and find your data and find your images. As if you were doing this on your server, you're simply just doing this on the CTERA unit. So we begin to open the folders. We go into the Dexys imaging suite, and then we go into our data. And in the data, you will find all of your images. And once we open those images, now we're where we need to be. Now find your 6-digit number that you had noted when you open the activity log of the image that you want to verify. The first 2 digits will be initial folder. The second two will be the next folder, and the last two will be your image. So you just drill down slowly but surely, and you will find that image. Once you see it, simply click on the image. After you click on the image, it will ask you if you want to open it. Click yes. Let's open it. And there is my image that I took 2 days ago that I know is on the CTERA server. If my image is here, I'm confident my backup is sound. That's all you have to do. It takes about 5 minutes. Do it once a month. Do it once a week if you feel you need to. Once you do it, you know your backup is secure and it is sound. And your practice is safe. And if you think I wasn't accurate before about TechCentral being on top of everything, this was an email received just a few days ago telling me that my cloud backup did not go through. I immediately panicked, obviously, opened my CTERA hybrid backup unit, tested to verify an image, and sure enough, the image was on the CTERA unit. So what was happening, I then called TechCentral, and TechCentral then told me that the backup did not go through because we updated the software. Let us reboot the CTERA unit from here, and then you'll be good to go. So I knew that our in-office backup was valid. It was just our cloud backup that was not. An email like this shows me TechCentral is doing exactly what they need to do to keep your data safe. Thank you, everyone, for listening. I can't overemphasize how important your data is. I don't want anyone to have to go through what we went through. And now TechCentral has made it simple and easy and effective to make sure that your data is safe. Thank you, everyone. I'm going to now pass on to Jeff Drost. He's the sales specialist at TechCentral, and he can guide everyone through what needs to happen to migrate your data and backup to the CTERA TechCentral hybrid backup. Thank you.
Thank you, Dr. Mark. Ladies and gentlemen, this is Jeff Drost. I have worked for Henry Schein TechCentral the past couple of years, and what I would like to bring is over 20 years of experience in different industries to let you know how we can help, Henry Schein's TechCentral can help with your technology wants and needs. So you might not know who TechCentral is. TechCentral is the IT arm of Henry Schein. We work with your hardware. We want to take a look at your practice network to make sure whatever programs, technological equipment, or digital equipment that you have, that everybody, if you will, plays nice together. They communicate. We all know what happens sometimes when different programs, different pieces of equipment don't talk well with each other, kind of puts a little stoppage on production. So what Henry Schein likes to do, TechCentral specifically, is we like to set up a remote assessment to help you take a look at all those different components to make sure that they play well with each other. The first step for us to do that is, again, a remote assessment. So what is that remote assessment and what can it do for you? First and foremost, we need y'all to raise your hand and say, yes, I would like a technology remote assessment. An initial call will go out to you. What we'd like to do is schedule a time that is convenient for you at the practice. We do need a member of your team, just about 30 minutes, to kind of be our hands and our feet, take us around your practice. I want to emphasize that nothing gets installed on your network. All we are doing are pulling the specs off of your technological hardware throughout your network, just to make sure it's meeting specific requirements and needs of any programs that you're running. Next, what we'll do is we'll kind of put together a plan, and we'll take a look at that report, and either someone at TechCentral or someone from Henry Schein will come out. We like to do it over the phone, just it makes it quicker. It's easier for everyone to kind of look at their schedule. We will review that with you, and we will create a plan going forward of where you want to go. Maybe it's not where your practice is today. Maybe it's where your practice is later on this year, next year, the next couple of years out. No surprises for you. You know what you have. You know what you're working with. You know where you want to go. We will let you know how you can get there. So earlier in the call, we had talked about a hybrid backup. What TechCentral likes to offer to you is something very turnkey. I'm sure some of you right now, you are either personally responsible for hitting the button and backing up your data, or you have a member of your team doing that. What TechCentral likes to offer is take that off of your plate. We handle it. We do it remotely for you. You now can, and your team now can, focus on that patient care, on practicing dentistry, your specialty, what you're good at. We also have support and monitoring for you. I would like to emphasize this as a reactive and proactive plan. Reactive meaning if there's a break fix or you have an issue, you call into TechCentral, and we remotely will assist you with that. And we do remotely solve over 90% of those issues over the phone. The proactive piece is there. We can look at your server and make sure updates and patches are applied routinely so that there is no drop off in terms of speed or updates, that your network is running as smooth, as efficiently as possible. So you've raised your hand. You said you want in. I'll give you the two quickest ways to get to us. Number one, you can call us at this number, or number two, you can click on that link, and that lets us know you want that first step. You want that remote assessment, and we will get it going, get it working for you right out of the gate. Well, it looks like we have a few questions here, so I will turn it back over to Jim. Jim, looks like the first couple questions are for you.
Okay, we have a couple of questions that are directed toward me, Jim Crook at CTERA, so I'd like to take those now. First question is, can I access my files or backups if I lose my internet connection? Yeah, that's a great question, and the answer is yes. And that's really part of the beauty of the cloud storage gateway's hybrid architecture. And if you think back to the diagram we walked through, you have the ability to keep one set of backups and files locally on the appliance and one stored in the cloud. And so that means that even if your internet connections goes down, you still have access to those local backups and files, and you can access them over the WAN. And so as an added benefit beyond that, because you can recover those files locally, it means that the recovery and the restoration of your data, that process becomes much faster because you're not downloading the files from the cloud over the WAN. So it's a much more efficient process as well. If you ever have the option to recover from either your gateway or from the cloud, it makes much more sense to recover from the gateway just because it's going to be much faster than downloading over the internet. So thanks for the question. And we have another question. It's a statement actually directed towards me. The attendee says, I worry that storing my data on the cloud will make it vulnerable to hackers and data thieves. And so that's a really fair concern given the number of data breaches that come out in the news in the past couple of years, seemingly on a daily or weekly basis. Large banks, large credit cards, even military organizations, really on down the line, every sort of organization has been touched by these data breach events. So it's a very legit concern. But as we said, the TechCentral and CTERA solution was really built firstly around security and data privacy, and we want to help you mitigate these concerns. And so first of all, consider that all data on that gateway is encrypted before it's sent to the cloud. We talked about that as source-based encryption. And then it's also encrypted using TLS, the transport protocol TLS 1.2. And these are very high, very secure industry means of moving data from one point to the next. Data also remains encrypted in the TechCentral cloud, the TechCentral data center, meaning that even if a hacker ever gained access to that cloud, the data would be fully encrypted with AES 256-bit encryption. They need the keys to access that data. It would look like gibberish to them, much like that Word document that we saw earlier in the presentation. So, there are obviously causes for for looking out for your data when it's moving to the cloud, but we've built a platform with TechCentral that really mitigates those concerns and enables you as a dental organization with very high and strict patient data regulations to leverage a hybrid backup service like this. So thanks for that question. Okay, and now we have a couple of questions, it looks like, for Dr. Wilk, and then some for Jeff as well. So, Dr. Wilk, next question is for you.
Thank you. We're going to do some questions now. I see there's two questions that came in. The question first, and then I'll answer to the best of my ability. The first question is, Dr. Wilk, would you recommend using TechCentral IT support over a local IT provider? Why or why not? I would say from my perspective, I don't see how you could not. We've been using TechCentral for years, as they are tightly integrated with Dentrix and under the same Henry Schein umbrella. And things have never been more convenient for us. Years ago, before TechCentral, we had to have a disparate authorized vendor that wasn't kind of associated with Dentrix, but not tightly integrated. Do your hardware support and installs, and Dentrix worried about their software. Well, inevitably problems and issues arise, and what was happening because these entities were not integrated together was that the software component would blame the hardware component, and the hardware component would blame the software component. Ultimately, problems get solved, but it just takes so much longer when they are not integrated. When they are working together as a team, that will help. Now, TechCentral is tightly integrated and works with Dentrix, but TechCentral is knowledgeable and with any management software in the dental industry. Their expertise in hardware installs, and now with the CTERA eBackup hybrid unit, it's unsurpassed by any other hardware company. The second question is, my staff is not very savvy with technology. How can I expect them to oversee the process of backing up important data? Well, honestly, who really knows what format and files are required for backup except the experts? And TechCentral is the expert. And not only are they the expert, but TechCentral Hybrid Backup has completely automated backup. So your staff no longer has to do anything. Previous backup iterations, when it was manual, I did it myself because I didn't want to rely on my staff for any errors or any problems. And yet still even I couldn't be all that reliable. So now TechCentral has removed that completely from the equation. Now, as long as your CTERA unit is reliable, which you can verify, then you know your backup is sound. Thank you, everyone. I'm going to pass it along now to Jeffrey Just.
All right. I have two questions here. The first one is, I don't know if having a hybrid backup service is worth the cost. Let me explain it this way. Hybrid backup is like car insurance. It's actually like full coverage car insurance. I know that I hate, and I'm sure you hate, making that monthly payment for insurance. Hopefully we never have to use it, but in the event we do, we're always thankful that we opted for the full coverage. Hybrid backup is basically that same thought process. Hybrid backup supplies your practice with multiple points in time that your data is backed up. Data breaches and attacks are increasing in frequency, and those attackers are really becoming very cunning and adept at getting to your data. So providing as many possible data points actually decreases the potential of what we like to call mission-critical data loss. Ultimately, right, it's production loss. Plus, I also want you to know the cost of a reliable backup can be very little compared to your actual cost of a data breach or data loss after you consider everything, the fines, the lost revenue, and more importantly, or most importantly, your damaged reputation as a practice. Looks like I have another question here, and it's why shouldn't we just use a cloud-based service without a local backup? A couple different points here. Number one, HIPAA guidelines outline two distinct or two different methods for backing up. One is physical and one is non-physical, if you will. Another way to look at that is one is on-site and another is off-site. On-site, as you all know, can be accomplished probably by either you probably have paper documents, you probably lock them in a cabinet, you store stuff on your server or your PCs, or even, again, that NAS device, that network-attached storage device. Well, off-site is done via a cloud backup. Does each method have pros and cons? They absolutely do. But if you have both, it allows you to store and access your patient database efficiently and productively. You can navigate the burden on your practice after an attack or a data loss. Ultimately, look at the reason you don't just want a cloud-based service is in that event of if you lose your data and the access to the internet, you should have your data stored locally somewhere. You can get to it quickly. You can get your practice back up and running. So I'd like to thank you all for attending. If you want to find out more, you can visit this link or you can give us a call. Again, thank you all. Have a wonderful day.